If you're over the age of 60 and currently taking medication for high blood pressure, this may be one of the most important videos you watch all year. Blood pressure medications save countless lives every single day. However, cardiologists are now raising concerns that some commonly prescribed blood pressure drugs may come with hidden risks for older adults, risks that often develop slowly and don't always show obvious warning signs at first. We're talking about side effects such as sudden dizziness, sharp drops in blood pressure when standing, increased risk of falls, confusion, and complications that can quietly reduce independence over time. And here's something many people don't realize. These risks usually aren't caused by taking medication incorrectly. They happen because the aging body processes medications differently than it did decades earlier. Research from respected institutions like Harvard Medical School, Mayo Clinic, and other leading medical centers shows that after age 60, certain blood pressure medications require extra caution. This is especially true when doses aren't regularly reviewed, medications are combined, or treatments are continued long-term without reassessment. Today, we're going to walk through 6 types of blood pressure medications that doctors closely monitor in older adults. This information is not meant to frighten you. It's designed to help you have more informed, productive conversations with your doctor or pharmacist. Before we begin, take a moment to comment below with your age and the city or country you're watching from. We love seeing where our experienced and wise viewers are joining us from.
Let's get started. Number 6. Alpha blockers and combined alpha-beta blockers. Number 6 includes alpha blockers and combined alpha-beta blockers. These medications are sometimes prescribed to help manage high blood pressure in older adults. At first glance, they appear to be a smart choice. They lower blood pressure by relaxing blood vessels, allowing blood to flow more easily. However, this same effect can create problems as we age. Cardiologists and geriatric specialists have long warned that these medications are strongly associated with orthostatic hypotension, a sudden drop in blood pressure when standing up. If you've ever stood up and felt dizzy, lightheaded, or unsteady, this is especially important to understand. As we grow older, the body's ability to quickly regulate blood pressure slows down. Harvard Health Publishing explains that blood vessels don't tighten as quickly, and heart rate responses become less efficient. When a medication further relaxes blood vessels, blood pressure can drop suddenly before the body has time to compensate. This is where the risk becomes serious. Even brief dizziness can result in a fall. For older adults, falls are not minor incidents. They are a leading cause of injury, hospitalization, and loss of independence after age 65. Because of this, alpha blockers are rarely used today as first-line blood pressure treatments in seniors, unless there's a specific medical reason. When they are prescribed, doctors typically start at the lowest possible dose and monitor symptoms closely, especially during the first few weeks. Timing also matters. Standing up quickly in the morning, getting out of bed at night, or rising after sitting for long periods can all trigger sudden blood pressure drops. That's why clinicians often advise older adults on these medications to stand slowly, pause before walking, and report any dizziness immediately. It's crucial not to stop these medications on your own. The issue is not that they are dangerous for everyone, it's that they require careful supervision in seniors. Up next is a medication that millions of older adults take daily and one doctors now monitor more closely than ever.
Number 5. Diuretics, water pills. Number 5 includes diuretics, commonly called water pills, such as hydrochlorothiazide and similar medications. These drugs are widely prescribed to treat high blood pressure, especially in older adults. Diuretics work by helping the kidneys remove excess sodium and water from the body. This lowers blood volume, reduces pressure in the blood vessels, and decreases strain on the heart. Because they are effective and affordable, diuretics are often recommended as a first-line treatment. However, research shows that older adults respond differently to fluid and electrolyte changes. Aging affects kidney function, thirst sensation, and the body's ability to maintain proper hydration. According to Harvard Health Publishing and Mayo Clinic, this makes seniors more vulnerable to dehydration even when taking diuretics exactly as prescribed. Dehydration in older adults can cause fatigue, weakness, dizziness, dry mouth, and confusion. These symptoms often develop gradually and may not immediately be linked to medication use. Electrolyte imbalances are another concern. Diuretics can lower potassium and sodium levels. Low potassium can lead to muscle weakness, cramps, and abnormal heart rhythms. Low sodium levels have been associated with confusion, balance problems, and increased fall risk. Diuretics are also linked to orthostatic hypotension because reduced blood volume makes it harder for the body to adjust blood pressure when standing. This significantly increases fall risk in older adults. Timing matters here as well. Diuretics increase urine production, often leading to nighttime bathroom trips. Mayo Clinic notes that getting up at night, when blood pressure is naturally lower and lighting is poor, further increases fall risk. For these reasons, guidelines emphasize regular monitoring for seniors on diuretics. This includes blood tests for electrolytes, blood pressure checks in both sitting and standing positions, and periodic medication reviews. The key point is this: diuretics are effective and often beneficial, but in older adults, they must be carefully individualized and regularly evaluated. Symptoms like dizziness, weakness, or confusion should never be dismissed as just aging.
Number 4. Calcium channel blockers. Number 4 includes calcium channel blockers such as amlodipine and diltiazem. These medications lower blood pressure by blocking calcium from entering heart and blood vessel muscle cells, allowing blood vessels to relax and widen. They are commonly prescribed to older adults and are generally effective. However, aging changes the cardiovascular system. Blood vessels stiffen, reflexes flow, and the nervous system responds more slowly to posture changes. Harvard Health Publishing and Mayo Clinic note that calcium channel blockers can amplify these age-related changes. One major concern is orthostatic hypotension. Because these medications prevent blood vessels from tightening quickly, blood pressure may drop when standing. This can lead to dizziness, lightheadedness, and instability, factors strongly linked to falls in people over 65. Some calcium channel blockers can also slow heart rate, causing fatigue and reduced exercise tolerance. While not always dangerous, these effects can reduce strength and balance over time. Leg and ankle swelling is another well-documented side effect, especially with amlodipine. Mayo Clinic explains that relaxed blood vessels allow fluid to leak into surrounding tissues. This swelling can alter walking patterns and increase fall risk. What surprises many people is how gradually these symptoms appear. Fatigue, swelling, or mild dizziness may be mistaken for normal aging rather than medication effects. Doctors usually start seniors on lower doses and adjust slowly. Medication combinations also matter, as combining calcium channel blockers with other blood pressure drugs increases the risk of low blood pressure. The takeaway: calcium channel blockers are effective, but ongoing monitoring is essential. New symptoms should always be discussed with a healthcare provider. Number 3. Beta blockers. Number 3 includes beta blockers such as metoprolol, atenolol, and propranolol. These medications have been prescribed for decades and are used for high blood pressure, heart rhythm issues, and after heart attacks. Beta blockers reduce the effects of adrenaline, slowing heart rate and lowering blood pressure. They can be life-saving, especially for heart disease. However, aging affects nervous system responsiveness and heart rate variability. Harvard Health Publishing and Mayo Clinic explain that beta blockers can exaggerate these changes in seniors. One concern is excessive heart rate slowing, known as bradycardia.
This can cause fatigue, weakness, reduced stamina, and dizziness, often mistaken for normal aging. When heart rate response is blunted, the body may struggle to increase blood flow during activity or when standing, increasing fall risk. Some beta blockers can also affect cognition, sleep, and mental clarity, especially those that cross the blood-brain barrier. Older adults may be more sensitive to these effects. Research also shows that for uncomplicated high blood pressure, beta blockers may be less effective at preventing stroke in adults over 60 compared to other medications. Because of this, many guidelines no longer recommend them as first-line treatment unless there is another indication. Beta blockers remain important for many people, but dose and ongoing reassessment are critical.
Number 2. ACE inhibitors. Number 2 includes ACE inhibitors such as lisinopril, enalapril, and ramipril. These medications are commonly used for blood pressure, heart failure, and kidney protection. They work by blocking the production of angiotensin II, allowing blood vessels to relax. In older adults, ACE inhibitors can cause excessive blood pressure lowering, especially when starting or increasing the dose. This can lead to orthostatic hypotension, dizziness, and increased fall risk. Kidney function is another concern. While ACE inhibitors often protect kidneys long-term, they can cause short-term changes, which is why kidney function and potassium levels are monitored. ACE inhibitors can raise potassium levels, increasing the risk of heart rhythm problems. Older adults are especially vulnerable. The persistent dry cough associated with ACE inhibitors can disrupt sleep and increase fatigue. Rarely, ACE inhibitors can cause angioedema, sudden swelling of the lips or throat, which requires immediate medical care. These medications are effective but must be carefully tailored and monitored in seniors.
Number 1. Angiotensin receptor blockers, ARBs. Number 1 includes ARBs such as losartan, valsartan, and candesartan. These medications are widely prescribed and often seen as safer alternatives to ACE inhibitors. ARBs block angiotensin II directly, keeping blood vessels relaxed and lowering blood pressure. While generally well tolerated, ARBs still pose risks in older adults. The most common concern is low blood pressure when standing, which increases fall risk. ARBs can also affect kidney function, particularly in seniors with reduced kidney reserve. Potassium levels may rise, increasing the risk of heart rhythm issues. Many ARBs are prescribed in combination pills with diuretics, which can increase the risk of dehydration and electrolyte imbalance. Because ARBs are so common, symptoms like dizziness or weakness are sometimes overlooked. Blood pressure medications save lives, but in older adults, the right medication, dose, and monitoring are more important than ever. Understanding these risks empowers you to take an active role in your health. If this video helped you, please like, subscribe, and turn on notifications for more evidence-based senior health content. Now we'd love to hear from you. Which medication surprised you the most and why? Share in the comments below. And remember, never start, stop, or change any medication without consulting your doctor or pharmacist. Thank you for watching. We'll see you in the next video.